Just how impactful is the power of suggestion or expectation when it comes to our minds and being treated with anything in the medical space, but especially the hair loss space? Can we lose hair when we're infused with normal saline, which is benign, in a chemo trial simply because we're told that hair loss is a potential side effect? Can we grow hair when we're given a sham low-level laser light device because we expect that you can potentially grow hair with this therapy? Can we lose function downstairs when we're given a hair loss drug like Finasteride because we read certain articles on the internet and we speak to other people that have had these side effects, and then our doctor also informs us about these side effects? Well, these are all things that are fascinating and come under the umbrella of either the placebo or the nocebo effect. And today, I'll be focusing on the nocebo effect and how this might be impacting you on your hair loss journey. Hi, I'm Dr. Jonathan Hopkirk, Sydney-based hair loss doctor, and I love nothing more than to help take people's hair confidence to new levels. Today's discussion, I'm going to go over the fascinating phenomenon that is the nocebo effect. In today's video, you will learn these 4 things. 1, what is the nocebo effect? 2, how might the nocebo effect be impacting you on your hair loss journey? How can we distinguish between an actual side effect from a drug and a potential nocebo effect? And what to do if you experience a potential nocebo effect, and how you can potentially reduce the impact of nocebo effects when you're taking hair loss drugs or undergoing hair loss treatments. All right, let's get into it. So your mind is so powerful that it can make a hell of heaven or a heaven of hell just based on what you're thinking. For all my Spanish or Portuguese listeners out there, you might understand the phrase cada cabeza es un mundo. Every mind is a world. And nothing is truer than when it comes to the physiological effects that our psychology can have on us when we're taking certain hair loss drugs. First off, it's really important that we understand the difference between the placebo effect and the nocebo effect and how these are distinguishable from each other. So, the definition of the placebo effect in the Oxford Dictionary is a beneficial effect produced by a placebo drug or treatment which cannot be attributed to the properties of the placebo itself and must therefore be due to the patient's belief in that treatment. So a clear example of this in the hair loss space would be in this study, for instance, that I read recently with respect to the low-level laser light therapy. In this randomized controlled trial, 2 groups were given either a sham device or an active device over a 17-week period, and then they did photo analysis to see how much their hair count had improved. Well, the patients that were given the sham device that emitted no low-level laser light therapy actually increased their hair count by about 12% just because they were receiving a treatment. So this is a true example of the placebo effect. Now, how does this differ from the nocebo effect? Well, the definition of a nocebo effect, if we were to take the MedSafe New Zealand definition, the nocebo effect is the opposite of the placebo effect. It describes a situation where a negative outcome occurs due to a belief that the intervention will cause harm. It is sometimes a forgotten phenomenon in the world of medicine safety. The term nocebo comes from the Latin to harm. So what would be an example of the nocebo effect in hair loss trials? Well, maybe not hair loss itself, but there was a study where a group of women in chemotherapy trials were either infused with the actual chemotherapy agent or normal saline. Both groups were obviously told about the potential side effects, of which one was hair loss. Well, fascinatingly enough, the group that received normal saline, which is a benign solution, 32% of them experienced hair loss in the days after being infused with the potential chemotherapy agent. So this is a true example of the nocebo effect. Now, how can the nocebo effect impact those who are taking hair loss drugs? Well, this is an absolutely fascinating study, which is always blowing my mind. So a bunch of men who were being treated for BPH, which is an enlargement of the prostate, they were being treated with 5 milligrams of finasteride every day over a 12-month period. But the group was split into 2. One group were informed about the potential sexual side effects of the drug finasteride, whilst the other group were not informed about the potential side effects of the drug finasteride. The groups were followed up and had to do questionnaires at both 6 and 12 months, and the results were absolutely fascinating. In the group that were not informed about the sexual side effects, only 15.3% of this group experienced any of their sexual side effects, whilst in the group that were informed about the sexual side effects, 43.6% of these individuals experienced some sexual side effects. So this goes to show that the power of the suggestion by the doctor when they are prescribing the medication to you can have a significant impact, so much so that it can increase your chance of these side effects by 3 times. Now, there's actually some really important nuances to the nocebo effect as well, and how you would receive such information and how it might then have an impact on your psychology. So if a doctor transmits their concerns about a drug or their belief about a drug, this can have a significant impact on how you would then go on to expect the effect of that drug on you physiologically. Give you an example. If I was to give you this bigger pill versus the smaller pill, and I said this bigger pill is the latest and greatest hair loss drug available, and it is likely to give you the best chance of success, versus giving you this smaller drug, and color has a big impact as well, but we won't go into that right now. But I gave you this smaller drug, easier to swallow, and I said to you, this hair loss drug is being shown to improve the effects in about 50% of people. You know, it's a moderate drug, it's safe, but there are better drugs in it, but we'll just start on this and we'll take a conservative approach to begin with. Well, the likelihood of these two drugs having an impact on the growth of your hair by way of the effect of my suggestion would be that the bigger pill on the left and the way I've transmitted my beliefs about that drug, that is going to have the bigger impact on you and your potential success. So that is an example of how a doctor can potentiate a placebo effect. Now, how can a doctor potentiate a nocebo effect? Well, as we've just learned in that study before, simply informing your patients about said side effects can cause the side effects, or at least increase the risk of that patient experiencing those side effects. But it goes even deeper than that. So the language that you use in terms of how you frame the statistics can also have an impact on the patient's mind based on the creativity and the imagination of their mind when they're being told about the side effects. Here's an example. So if I say to you, 3% of individuals who are given this drug may go on to experience sexual side effects. If I say it like that, it's very statistics heavy, and it doesn't give you the opportunity to imagine a person in your mind as much as if I said it this way. Same statistic framed differently. 3 out of every 100 men who take this hair loss drug may well go on to experience sexual side effects. You see, the difference there is the language. If I prompt your brain to think about men and prompt your brain to think about people, when I'm telling you about the side effects and I use the language 3 in every 100, not 3%, well, it changes the weight that you apply to the information that you've just received. So doctors are in a pretty precarious position in that sense when they are prescribing drugs for individuals, because they have a duty of care to do no harm to their patients. They also have an ethical and moral commitment to ensure that their patients are well informed before going ahead with taking any medication or undergoing any treatment. However, the doctor's words themselves can cast spells on an individual in the sense that they can potentially do harm just because they've informed them about the side effects in a way that is nuanced or not nuanced enough. So how can we distinguish between a sexual side effect that is attributed to something like, say, finasteride, which is a commonly prescribed hair loss drug? How can we distinguish between it being an actual physiological side effect of the drug or the nocebo effect, which is happening because we have expected it to potentially happen to us? Well, one of the sexual side effects that can occur is erectile dysfunction. So erectile dysfunction, loss of libido, premature ejaculation. These sorts of sexual side effects can occur with DHT mitigating agents like finasteride and dutasteride, and I've even seen it very rarely with things like saw palmetto. Now, this effect can occur due to the physiological impacts that those drugs have on our system by reducing certain sex steroid hormones in our body. So yes, there is a number of men that can be anywhere from 2 to 4 to 6%. Some hair loss doctors will tell you less than 1%, but it depends on what articles you read. It can be as high as 6%. So we'll say anywhere from 1 to 6% of individuals who take these hair loss drugs can experience sexual side effects. Now, if you were to be experiencing a nocebo effect-like side effect from finasteride and it was impacting your ability to get an erection, well, this is an important distinction that you can make. When you are asleep, your conscious brain switches off. And so one of the things that you can do is just check to see if you wake up with an erection. Most men should be waking up with an erection in the morning. Now, if you were waking up with an erection in the morning and your conscious brain has been switched off when you've been asleep and you wake up with an erection in the morning, however, when it gets to the time of actually going to have intercourse and you're struggling with being able to get an erection and you're taking finasteride, well, it could well be that you're having a bit of a nocebo effect. And you have the psychological impact of knowing that finasteride could be causing the psychological harm, which could be causing the erectile dysfunction. Now, when you are then aware of the fact that actually I'm waking up with an erection, so therefore that means that actually this could just be in my head, because otherwise if it was a functional problem, I wouldn't be able to get erections when I wake up. That might actually be enough to give you reassurance that, hey, this is all in my head. I'm going to forget about that, and then just see what impact that has on you when it gets to having sex again. So what are some ways around potentially experiencing a nocebo effect, and what should we do if we do feel we're experiencing a nocebo effect? Well, context matters. Context is so important. There is something called the Yelp effect when it comes to drugs. So often people will report the negative consequences of drugs or side effects online, which is why you can find side effect related groups like post-finasteride syndrome group, which is a very important group. It's not to invalidate the importance of these sorts of groups. I've visited these groups myself, having experienced post-finasteride syndrome. However, context is really important. When you read up about negative consequences of drugs because they've been posted online, either before taking the drug or whilst taking the drug, well, you're priming your brain to be more alert to and more vigilant around potential symptoms that could be making you think, actually, am I experiencing the side effect? So there is such a thing as the power of suggestion by doctors' words, but also the expectation effect. So what you expect to happen to you. If you know yourself that you're someone that is quite anxious around side effects, it's important to be really introspective about these things, because you may well potentiate or exacerbate a potential symptom by way of having too much knowledge on that potential side effect from doing reading on it. So it's important to have a balanced understanding about side effects. And when we get given this information by a doctor, or we read information online and we hear what I just said earlier, which is anywhere from 1 to 6% of people taking finasteride might experience sexual side effects, well, for us to recalibrate our minds and go, well, that also means that 94 to 99% of men who take these drugs will not experience the sexual side effects. Well, those are pretty good odds. Doesn't make it any less significant for those who experience the side effects, but for the 94 to 99% of those individuals who don't experience the sexual side effects, well, that's a large number of people. And if you were told it that way, rather than the way I told you earlier, well, then that's potentially going to actually lead to you having more chance of a positive effect and less chance of a negative effect. So context matters, and there's things that we can do by reframing and recalibrating the information we receive to give ourselves a balanced understanding. What can doctors do when they deliver the information? Well, as I was saying just then, doctors can deliver the information by actually showing what the positive effects are as well as detailing the negative effects, so we don't just purely focus on the negative. And it's also so important that doctors are mindful of the language that they use when talking about certain side effects. We also need to be incredibly mindful of the effect that media can have on us and what we consume. As you saw when Ozempic came out, it was the new miracle cure for diabetes, and it was going to have huge impacts across the world. Well, you fast forward a couple of years down the track and there's mass hysteria about the damage it's causing to people. We saw the same with COVID. We saw the same with COVID vaccines. The media can grab onto something and they can spread negative misinformation like wildfire, and that can actually have harmful impacts on those who are actually using those medications or drugs. So it's also incredibly important to pick and choose where you consume your information from. Be incredibly mindful around what preconceived ideas you might have about a drug before going into using this potential drug. And this will prompt a very good opportunity for you to have a discussion with your healthcare professional or your treating hair loss doctor before using this medication. So then that doctor can give you balanced statistics, but they can also potentially give you an alternative option. And an alternative option might give you more peace of mind. So never think that you have to take a medication. Never think that you have to do a treatment, because there are always alternative options. They may not be as effective for you. However, if it gives you peace of mind, well, that's a very important thing to have. And if you do experience side effects, whether it is a nocebo effect or whether it is a actual physiological side effect, you're still experiencing the effect. So I would always encourage patients to seek the counsel of your treating hair loss doctor or healthcare professional so they can actually address this head on and give you guidance on how to manage this personally. I hope this information has helped you. If you want to learn any more about this information, I'm posting some interesting articles in the show notes. Also, feel free to ask any questions that you may have in the comments, and I can even do further videos on this potential topic if you have particular questions on it. Hope you're all well. Hope you're all having a good week. Chat to you next week. Cheers.